Hello and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. My name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps program, and I'm joined by my colleague Karen Odegaard.
Good afternoon. I'll be helping to answer your questions throughout today's webinar, as well as sending out some links via the chat box throughout the webinar. So you can watch for those coming your way in that chat question box.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Foundation and the University of Wisconsin Population Health Institute. Thanks to the support of the Foundation, we have 4 community coaches in our program, and our assistance is no cost to you. So please don't hesitate to contact us if you need assistance with a tool, a question, or a next step in your process. We're here to help. We want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts, and on the left you can see the viewer window where you'll see my screen throughout the presentation. On the right you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we're going to be taking questions via the control panel. As questions pertain to the content we're covering, we're going to pause and answer them along the way. There's also going to be time for Q&A toward the end of the webinar. So as we go through the webinar, if you have an idea or a thought, a tool, or an example, please feel free to enter these in the chat box and we'll make every effort to share them with everyone on the call. We'd also like to encourage you to be thinking about who else do you need to share this information with, and what's one idea for action that you're taking from this webinar. And what else do you need to know to take action or use this information? So these are just some questions to get you thinking and maybe jot down some thoughts as we go along here. Here's a look at what we're going to talk about today. We'll start with an overview of the program, then we'll demonstrate how you can use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps Action Center can help you move forward and how you can learn from others. And throughout the webinar, we'll head over to the countyhealthrankings.org site to see how the site functions, so you'll walk away from today's webinar able to confidently navigate the site. This year, the Robert Wood Johnson Foundation laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So we start this webinar with an essential question. How can County Health Rankings and Roadmaps help build a culture of health in every community? When you look at a quilt, there are many pieces of fabric, different colors and shapes, all interesting in their own right, and they're all stitched together to serve a common purpose. In the same way, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose to build a culture of health, county by county. As we share the various components that make up the County Health Rankings and Roadmaps program, think about which piece or pieces of the program you can use. So let's start by reviewing the County Health Rankings. Why do we rank? The rankings take several different pieces of data and simplify them. They give communities a quick and easy snapshot of their health and of the many factors that impact how well and how long people live. The rankings serve as a hook and generate media coverage. This is a good thing because it helps people understand the health status of their community. It also provides an opportunity for people to tell the story of the many factors affecting health in their community. And rankings add context. A number by itself doesn't tell us much. The rankings allow communities to compare themselves with others within their state. They can also compare to the top U.S. performers on individual measures. Rankings are a call to action. They provide an opportunity to ignite discussion and action at the local level with many diverse members of the community from multiple different sectors. The County Health Rankings are our starting point for discussion in communities, not an ending point. Communities are going to want to dig into local data to further understand what's going on in order to know where and how to take action. Let's take a look at the thinking behind the rankings. We start with population-based data from a variety of sources, And we don't make that up. We get that from all over the different places, and we'll talk about that later in this webinar. And then we use that data to rank the health of nearly every county in every state. Each year, the rankings release generates a lot of national, regional, and even local media attention. And community leaders use the rankings release to get the word out to their community and the local media, and they use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. And based on a deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally. And over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all children and all the adults in the community. And essentially, the county health rankings really, at the end of the day, aren't about numbers. They're all about a call to action. The horizontal portion of this picture underpins the rankings. The county health rankings show us that where we live matters to our health, and that a broad range of factors impact how long and how well we live. The vertical portion underpins the roadmaps. The roadmaps offer communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. This graphic shows our theory of change about how rankings can be a catalyst for action that improves the health of everyone in a community. Now let's take a deeper look at the rankings part of this picture. For each county, you will find two rankings, one for health outcomes and one for health factors. There are two separate sets of messages these ranks convey. The health outcomes rank shows how healthy a county currently is. We call this rank today's health. The health factors rank shows how healthy a county might be in the future based on the many factors that influence health. We call this rank tomorrow's health. This is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, availability of jobs, access to healthy foods, clean air and water, and our social connectedness all impact our health outcomes. So starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, which are in the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes in the green boxes to show how healthy each county is, the length of life and quality of life. Because much of what affects our health happens beyond medical care, this model and the rankings that are based on it underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities.
Jana, we have our first question here, and on the rankings model we can see these different weights all along those health factors and health outcomes. So the question is, how are those percentage levels determined in the rankings model? And so it's a great question, and I'm going to actually chat out a link to where you can read more about this, but the summary of what we used to determine the weights and measures was guided by a couple of things. First of all, a review of the literature to help us understand the impact of various factors on health outcomes. So we're looking to the literature. Also the ability for factors to be modified through community action. So what is it that communities can do? Can communities take action on these factors? A lot of our work comes from and was inspired by America's Health Rankings, which ranks the health of states. And so we look to their methodology and their indicators as a way to help understand what ours might to help shape our model. And then we also think about the availability and the reliability of indicators at the county level throughout the nation, and we rely on feedback from a panel of technical experts that helped us shape this model. So that's just a little bit about what all went in to these weights and measures, and you can again read more at the link that I just chatted out.
Great. Thanks, Karen. That's wonderful. So I'm going to move on to, and there might be questions related to how we get the measures. So let's address that right now. We look at the many factors that make up health, and so let's take a look at the measures themselves. We want communities to take action. As Karen said, that's a key criteria for the model itself. So we use measures that reflect aspects of a community that can be improved. We use only measures that are valid, reliable, recognized, and used by other similar national measurement or rankings projects. So Karen mentioned the America's Health Rankings, which annually measures the health of states. There's other sources as well. Our measures have to be available at the county level for every county in every state. That can be somewhat, that's a parameter, so we have to keep that in mind as you look at why aren't we including other measures. It has to be available at the county level. The data we use has to be available at low cost or free and needs to be as up-to-date as possible. We use fewer measures. There are 34 measures in 2014 because really the rankings are meant to be a snapshot only. The data is a starting point for communities. And I think at this point Karen is going to be chatting out the link for the information about where the data comes from, the data sources on each of the measures.
We also have a question here, Jan. Is there any way that you can get the data that is less than 3 years old? So regarding the age of our data, we have a question on that. And it's a really great question. It's important as you look at your data from the County Health Rankings to understand what it is you're looking at. And Jan, as she does some of our web tour in a little bit, is going to walk you through so you can see exactly what year the data comes from. But actually our data ranges in age, and sometimes it's a year old and sometimes it's several years old, and it just depends on the data source and the quality and the validity of that data. So sometimes we're pooling multiple years of data to really help have a stable number there. So that's where we'll see some older data in our measures. That is, you know, in anybody who works with data, that's a challenge, is lag time in data, and it's something that we understand. Looking to other data sources in addition to the County Health Rankings may be a good way to see if you can find newer data. You may be able to find newer data from your state. You may be able to find newer data from your own local community. So those are great options to look at. We are always using the most up-to-date data that we can, given those other considerations that we have for data and making sure that we have data for every county and every state.
Thanks, Karen. Well, let's talk about some of the new measures we've added in 2014. This year we added housing and transit to the rankings model. We've also updated our measures to help communities better understand their food environment, exercise environment, alcohol use, access to mental health providers, and injury deaths. And if you're interested in learning more about these updates, you can watch our archived webinar describing the new measures or check out the supplemental handout from that webinar with Q&A and a summary of the new measures. And Karen is chatting links to the archived webinar in the handout now.
Yeah, those links just went out to you, so you can feel free to take a look at those archived webinars and additional handouts. We have a question, and we often get this question about why do some of these measures change from year to year? And we have committed to maintaining the same measures under our health outcomes, so the measures that we use for length of life and quality of life will stay the same from year to year. So those are important measures that communities can really take a look at over time. But under health factors, we want to be able to give you the best information that we can each year with the release of the County Health Rankings. And so sometimes that means that we might find a better measure that better describes a particular health factor. Sometimes it means that we'll add a new measure, something that has become available to us that can give some really important information to your community. So again, we want to just make sure that we're getting you the best information that we can each year with those health factors measures. And so that's some of the reason for that we will add new measures on an annual basis.
You know, sometimes when we hear this question, there's a question underneath it, which is, If we're looking at the ranks, our health factors rank is going to change if the measures change. And that may not be fair, and we've heard that sometimes from folks. And something to keep in mind is that as we add these measures, the rank, the health factor rank, will change for all the counties in your state. So, you know, if the individual measures are addressing things that you've put in place in your county and in your community, and they're working well, then you're going to see that bump. The other thing to say, too, is that we've got a new tool, which I'll be sharing with you soon, about measuring progress, which helps you get beyond the ranks as a way to measure progress, because that's just one data point. It's a starting point, and really there are other ways to dig into the data and tell more of the story of what's going on. So I'm going to, next we're going to go into the website. We've looked at the model and the measures, and now we're going to go into countyhealthrankings.org. And the first segment of our web tour is going to focus on introducing you to some of the key navigation tips and exploring the rankings data. So you can see the navigation bar at the top of the page on our website. It remains at the top of your page, throughout the site. And it's a great way to navigate around the full site with just a few clicks from this orange navigation bar. No matter where you are, you can always scroll up and click the County Health Rankings and Roadmaps logo and get back to the home page. Using the Rankings menu, you can access information about our approach, the rankings data and methods, as well as tools to help you understand and use your data. You can also search here for your state or your county. Using the Roadmaps menu, you can access tools to help you take action and learn from others. And some of the other items that we have in this orange navigation bar are tools and resources, where you'll find a variety of tools and resources from rankings documentation, like data sources, where do they come from, what are the changes to measures, and other items. You can also find Action Center tools. You can find a rankings and roadmaps presentation with slides and notes that you can use and download and use in your community to communicate about your community's health. You can also find webinars, both archived and upcoming, and you can check out our county by county blog. You can search the site as a whole. You can learn more about the program and find FAQs. We're celebrating 5 years of the County Health Rankings this year, and you can look back at where we've been and read more about what's new this year, and look forward to all that's going to come here in the celebrating. You can look forward to everything that's going to be happening to celebrate the 5 years, and it's all on this page. So a couple of things to note here. There's the What's New for 2014 section, which provides a nice summary of changes to the model and the Take Action cycle and improvements to the site. You'll also find our 2014 County Health Rankings Key Findings Report, which includes a summary of key national findings, information on key measures and new measures, and a lot more. Now going back to the home page, I'll click on the logo. We can scroll down and see a progression of tabs in the middle that can help you think about how you can use countyhealthrankings.org to explore your rankings data, to move forward with action, and to read and share stories that can help you see and share results of other communities. Then if you scroll a little further, you can see the map of the United States and a search bar where you can enter your county or your state name. We're going to click on the map to begin to explore the rankings, and I'm going to click on New York as an example. So when I click on New York, I see the state overview, which shows both the health outcomes in green map and your health factors map in blue. From this page, if you scroll down, you can download data and find more data sources and resources from your state, and you can browse community health improvement resources for your state. You can find stories specific to your state, and you can find your state contact. You can also link from here to the Action Center, which we'll talk more about in a bit. From your state page, you can either select your county with the drop-down bar, or you can go to the map and you can click on the county on the map. So I'm going to click on Madison County. And we'll see the snapshot for Madison County. This county snapshot is, you'll notice by the way, we've progressed from the tabs. We now have, we've progressed to the second tab up at the top. We're in rankings. And these tabs offer another way to explore the data. You can explore the measures, get to the downloads for your state, and you can compare multiple counties within your state. So turning to the county snapshot, you'll find in the first column, this is where you'll find our measures. And we have 34 measures here. And if you hover over them, each one explains briefly what they're about. You'll also see 2 overall ranks: health outcomes for today's health, in this case 14 for Madison County, and health factors, in this case 14 again for Madison County. You'll also find ranks for each health outcome, the length of life and quality of life, and each health factor in the far right column. Your snapshot contains 4 columns of data. First, you find your county data, and here you'll see data specific to Madison County, New York. And next, we've included trend graphs for 12 measures where sufficient trend data is available. You can see a detailed graph of the trend data by clicking the graph icons next to these 12 measures. We have color-coded each icon to help you quickly see whether your county's estimate, your county's data is increasing, decreasing, or staying the same. The red icon, the red graph, indicates your county is getting worse, yellow indicates the county is staying the same, and green indicates the county is getting better. So let's take a look at the trend graph for adult obesity for Madison County. You'll see your county's trend in orange, your state's trend in green, and the national trend in blue. So we have trend graphs for 12 measures. Next in the columns, you'll see the error margin. We use a 95% confidence interval, which basically means that we're 95% sure the actual number for your county is in the given range. In the fourth column, you'll find top U.S. performers. This is the 10th percentile for measures we're trying to decrease, like smoking rates, or the 90th percentile for measures we're trying to increase, like high school graduation rates. It's included as a value to aspire to. That is, only 10% of counties in the nation do better than that. And finally, you'll see your state column. This allows you to compare your county's numbers to your state overall. Scrolling up a bit, you'll see areas to explore, where this will highlight potential challenges a community may want to examine more closely. And when you turn this feature on, you'll see that orange boxes highlight in the health factor measures areas that you might want to explore further and you might want to look into to have a greatest opportunity for improvement. Your county snapshot also includes additional measures, which I'm going to click on now. And these measures provide additional data that might be helpful to you, but we don't use these to calculate the rankings. So these are specific to your state. Now I'm going to go back to the county snapshot. And you can learn more about each of our measures by clicking on the Measures tab, or by clicking on the measure name from the snapshot. So I'm going to click on the measure from the snapshot, and since we looked at adult obesity, let's take a look at that now and take a look at what that can offer us. And you'll see again the map showing all the counties for this particular measure. And you'll also see that we've progressed to the next set of tabs here. You can look at detailed data for the measure. You can see the full description, including why we use the measure. You can learn about the data source, and you can begin to browse relevant evidence-informed policies and programs related to that measure, and these come from What Works for Health, which we'll talk more about later in the webinar. To the left, you'll see a brief description about the rankings methodology and summary information about that measure. And you can navigate to other measures from here as well by going to this little orange box in the left corner and just clicking.
Jan, we had a question about comparing counties and wondering if you can compare counties between different states. It's a great question. It's a question we get on a fairly regular basis, and we generally discourage comparison between states for a couple of reasons. First of all, the county health rankings really aren't intended to be a national report that's going to identify the top 10 or 15 least healthy counties in the nation, or the top 10 or 15 healthiest counties in the nation. It's really intended to be a tool for communities in each state, and as a call to action in those states to identify the opportunities for improvement. We also know that a few of the measures that we use are state-specific, which is sort of a logistical challenge here, right? They're state-specific, and that makes comparing across state boundaries difficult. So while some measures can be compared across state, we generally advise and encourage people not to try and compare across states, because some of those measures are really state-specific and they're not comparing apples to apples across state lines.
Yeah, it's a great question. Thank you. So, continuing on, we've also included some tools on our site to help you understand your rankings data and to think about how you can measure your community's progress over time. So let's go back to the navigation bar at the top of the page, and you can use the rankings menu to get to using the rankings data and measuring progress. And I'm going to go to measuring progress because that's a new tool that we've added this year that helps you understand how to use the rankings measures and where to look for other data and whether to tell or how to tell if your community is poised for progress. There's a self-assessment in that Are You Poised for Progress link there. You can learn more about this tool, Measuring Progress, in our archived webinar dated April 22nd. So as you can see, countyhealthrankings.org offers a number of ways to explore your county's data as a starting point for change. And this brings us to the roadmaps, which offer communities resources to move from awareness to action. And let's go back to our slides now to learn a little more about roadmaps.
Before we jump into that, I am going to chat out a document, link to a document that does provide some of the guidance about which measures you can compare across states. I know I mentioned that you can compare some things across states, so we do have some guidance for that, and I'm going to chat that out right now. So back to you, Jan. Thanks.
Great. Thanks, Karen. So going back to our theory of change, roadmaps addresses the vertical section. And now that we have our community's attention, we want to find the best possible strategies to impact our community's health priorities. But how do we do this? The Take Action cycle is the how within county health rankings and roadmaps. At its core are people working together to improve health in a community, because we know that solving issues like low high school graduation rates and excessive drinking or poor health care, these problems require the wisdom and resources of people from all walks of life. You'll see many sectors, including community members, in the blue circles in the center of the cycle, reflecting the fact that no one sector alone can improve a community's health. Communities can improve health by using the steps of the cycle, assessing needs and resources, focusing on what's important, choosing effective policies and programs, acting on what's important, and being sure to evaluate those actions. Throughout this work, it's important to continually communicate with partners, policymakers in your community, and to know how to use media effectively to tell your story. The action cycle is the action part of the program, offering communities guidance, tools, and resources to move from awareness to action. And there are 4 core principles that are at the heart of roadmaps. It takes everyone, all of us working together, to improve the health of a community. And we need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and if you innovate, be sure to evaluate. And keep focused across the health factors, including social and economic factors. And finally, don't be afraid to take on policies, systems, and environmental change, which will create the greatest long-term change in health for the children and adults in your community. The Take Action cycle lays out a series of steps that communities can take to work together to build a culture of health. But these steps aren't always as clear and simple as they appear in this graphic. Making changes to improve health in communities is messy and it's complicated, and building relationships across sectors can be challenging. So we've designed a series of guides to help communities take each step wherever they may be in the Take Action cycle. So let's go back to countyhealthrankings.org right now to go and explore roadmaps. And the second segment of our website tour is going to focus on tools for taking action and learning from others. So we'll go back to our main page again. And we see that we can use the roadmaps menu on the navigation bar to find the Action Center, or we can use the progression of tabs at the center of the home page and click into Move Forward with Action. And I'm going to scroll down to the Action Center. As I mentioned, the Action Center includes a guide for each step in the Take Action cycle. And the guides describe the key activities within each step and provide suggested tools and resources and additional readings. You can start at Assess or enter the cycle at any step. Work together and communicate, sit inside, because they're needed throughout the cycle. So as you see, this is an interactive page. You can hover your mouse over each step in the Take Action cycle to see some of the questions that go with that guide, and this allows you to answer the different steps before actually diving into the guides.
We have a question about how you can use the county health rankings and roadmaps for community health needs assessments, and this is a great question. We know that a lot of public health departments are doing community health assessments. We know that a lot of hospitals are now doing community health needs assessments. Other groups, United Ways, are often assessing communities. So how do the rankings play into all of this? And it's a great question, and we always encourage people to use the county health rankings as a starting point. It should not be your community health needs assessment, but it definitely can support it, and it can support it with the data, but we would encourage you to look at additional data, looking at state data, looking at local data, what you can find locally. It also can provide a wonderful framework. So even if the data itself isn't all that useful in your community, that's okay, but that framework, that model that Jan pointed out at the beginning and said that this is our most important image, that model can help serve as a framework for your community health assessment. The Assess Needs and Resources Guide that Jan is sort of hovering on right now, this guide includes some really helpful guidance to help you think about how do you pull this rankings data into an assessment, what else might you want to look at, how do you get a fuller picture of your community's health needs and assessments, or health needs and resources. It also includes a number of tools that can help along the way as you start to design and implement a health needs assessment. So Jan's going to walk us through some of these guides here in a moment, but I wanted to just chime in about how that particular guide may be helpful in getting started with an assessment.
Thank you, Karen. So I'm just going to hover on a couple of these guides so you can see what's included in them. And then I also want to mention that we also have guides for each of the different types of people that are mentioned here in the middle of the action cycle. These guides provide information on the role that each sector can play in improving the health of their community, along with guidance on what they can do during each of the action steps. So let's take a look at one of the guides. I'm going to click on Work Together. And here you'll find a brief description of the guide, the purpose of the step, and who to involve in this step. You'll also find highlighted tools and materials on the right-hand side, and the option to download the guide as a PDF. Scrolling down, you'll see that we've broken each step down into key activities so you can find the most relevant guidance and tools for where you are in this step. And when you find a key activity that's of interest, and let's say we're interested in recruiting and involving diverse stakeholders, you can open that to read the guidance and explore the links and explore the related tools that go with that key activity. Now, new this year, you'll find community spotlights scattered throughout the Action Center and also in What Works for Health, which we'll be looking at in just a moment, that provide examples of programs, policies, and tools in action. Here we see an example community spotlight from the United Way of Greater Toledo that explains how they use 3 of the tools included in this key activity. So community spotlights are quick examples that focus on the nuts and bolts of how work is done, key partners, and accomplishments. I'm going to go back now using the back arrow to get back to Work Together. Throughout this site, you'll find these boxes inviting you to contact our team for personalized free help. Clicking on Get Help will take you to an email form that gets to one of our 4 community coaches who can help you think about what your next step is or which tools might be most useful to you. Now, I've been mentioning What Works for Health a couple of times, so we're going to go there by using the Roadmaps navigation bar again. What Works for Health is a resource of nearly 300 strategies that we've rated for strength of evidence. To learn more about the strategies that could work in your community, you can select a health factor of interest in these light blue boxes on the far right in the model, or enter a keyword in the keyword search box. A new feature in What Works for Health this year is that you can now browse new policies and programs, those that we've recently added. This is a growing and changing resource, and we're always looking for new strategies to include. So we encourage you to email us using the Help button in the site if you come across something you think we should take a look at. And on the model, let's take a look at the types of policies and programs we find under, let's just click on Income. When I do that, we see that we have 13 results. And from here, you can further filter your search by approach, or by decision maker, or by evidence rating. The highest rated strategies, those rated scientifically supported, appear first. And evidence of effectiveness can mean different things to different people. Our approach to assessing evidence combines what we know from scientific study and then also observations of unbiased experts. Each reviewed strategy is assigned an evidence rating based on quantity, quality, and the findings of relevant research. So if you click on a strategy, let's just click on Increase the Earned Income Tax Credit. You'll find the full entry for that policy or program, including the expected beneficial outcomes, evidence of effectiveness, the impact on disparities, and implementation examples and resources when available. This strategy includes a community spotlight, which highlights how Kentucky Youth Advocates is working on a statewide earned income tax credit. If you hover over the evidence rating thermometer, you can see our definitions for all 6 ratings. So now I'm going to go back to the Roadmaps menu and get back to the What Works for Health main page. You can learn more about our ratings and methods from the left navigation menu on the main What Works for Health page. So finally, we know that communities learn so much from each other's successes and challenges. And using the Roadmaps menu, we can look at where we can learn from others. You can find inspiring stories from the RWJF Culture of Health Prize winners. There are 6 videos and stories that show how these 6 communities are working on building a culture of health for all their residents. You can go to Stories and see a number of stories that highlight examples of communities taking steps to improve health from all across the nation. And then as part of our Roadmaps project, we have some great national partners that can help you engage other partners and leaders locally. You can learn more here about how United Way Worldwide, the National Business Coalition on Health, and the National Association of Counties are helping to bring the message of rankings and roadmaps to their local affiliates across the nation. So this will be a good place to go and look for, if you're looking for innovative ideas or what are other communities doing, this is a good source for going in and learning from others. So as you can see, Roadmaps provides step-by-step guides, tools, and resources to help communities move to action. And what we're going to do right now is move back into our presentation and go to questions and answers, your questions and answers. And I'll just start back with the reflection questions we posed at the beginning. This would be a great place if you'd like to share some of your thoughts here. This is a great time to do that as we move into Q&A.
So we'll give you a little bit of time to continue to think about those reflection questions that Jan had shown on the screen for a moment, and feel free to chat us and let us know how you're responding to those reflection questions that Jan's going to put back up on the screen here. But in the meantime, let's turn to some of your questions that we have thus far. Jan, we have a question that, I mean, this is a question that we get a lot, and it's about funding, because people are often looking for information about how do we find funding to do this work.
Well, it is a common question, and we do have guidance on our website for to help you answer that question. We have a guide for finding funding that will also help you assess whether you're ready to take on new funding, whether you're ready to and have the capacity to maintain that and evaluate whatever it is that the funder is expecting of you. We also have a relatively pretty recent webinar on partnering with funders and how to do that effectively and what are they looking for. But I also want to mention that most of the communities that have the best chances at getting funded are those that have, even before they start looking for funds, reached across sectors and partnered with others that from different organizations to create a vision of health that's focused on the multiple factors. And they've all started working together already. And when that's happened, then the funds start to come, because frankly, that's what funders are looking for. They're looking for multi-sector partnerships. They're looking for communities that are focusing on the many different factors of health. And they're also looking for communities that are looking at policy, systems, and environmental changes. So if you can do that first and start to reach across those sectors, that's something that's worked really well for communities. There's actually a great community story on the site from Central Michigan called Together We Can, about how they worked together for 2 years in a 6-county area across multiple sectors, and then as a result of that we're able to attract more and more resources. And a lot of what they say their success is due to is just being willing to ask.
Great. Great, thank you so much, Dan. I'm going to pull up that story from Michigan and share that with folks. I've also shared the funding guide that you mentioned, and also a link to the funders webinar. I'm going to queue you up with another question. We have one of our participants today has an opportunity to talk with media coming up, and is wondering about sharing this information with others. And this is, again, it's a common question. People have the opportunity to present this data maybe to their Board of Health, to community stakeholders, to the media. What tips might we have, or how can new users most easily present this information to their community stakeholders?
Yeah, that's a great question. We actually have on our site in the Communicate Guide, and you'll also find it in the Tools and Resources navigation button. There's a Town Hall in a Box communications kit, which is just lays out every single part of talking points and communicating with media, communicating with your community. And I believe Karen can chat out that link to you right now. So if you look at also the Communicate Guide, it also gives you some framing questions and guidance for, who's your audience, what message are you trying to communicate, why, what's the next step after you communicate that. So you'll find a great richness of resources on communication with regard to working with media and getting your message out. There's another question that we have up here, and there's a lot of great questions here actually. Let's see. Somebody asked about stress. It's an important effect on health behaviors, and why it's not listed as, I believe, I think they mean as, Linda, perhaps you can clarify this, but that's the question asker, but is it, not in the model? And certainly stress is sort of an outcome of not having, if you will, sort of upstream the conditions that would cause that. So if you are in a neighborhood, for example, that is unsafe, or you are feeling very isolated for any reason, or you don't have a job, or your child is not going to a school that is able to help them achieve at the where they need to be. They're not learning how to read and write and so forth. That's going to cause stress. So we actually are in the model, we put in those things that are the conditions that you as communities can change through policy, systems, and environmental strategies that would create the conditions to reduce stress. So, for example, obviously having safer neighborhoods. We've got a webinar that is from, we partnered with Flint, Michigan, where the Flint Police Department is doing community policing, and they talk about, Officer Tanya Meeks talks about what they're doing there to reduce the stress in their neighborhoods. And so you might want to go in and check out our webinars to see some examples of what communities are doing around that. Another question is, From Ryan, do health factors vary depending upon geography and county? So, I think that one of the things, so you talked about, Ryan, the higher transit issues in metropolitan cities. If you go in and look at that a specific measure, you'll see the description and the data source and so forth. I think it will really depend on what that measure is. I'm looking at Karen to see if she would like to add anything to that.
I think that the thing I would add is that the rankings really do help us start to see that where we live matters to our health. So we can start to see some of the disparities that exist between counties, and you can see that in different measures. And one of the things on this particular measure, I think some people may have anticipated that rural communities would get sort of dinged, if you will, on the transit measure, and that wasn't the case. And so that was something that we looked at and we try to understand a little bit what's happening with measures in different parts of a state, and whether it's a rural community or urban community. The measures themselves are consistent no matter where you are geographically, but it does help us see that that where we live matters to our health, and so we can start to see those disparities that take place. We do have another question from Jill about the areas to explore, and wondering what exactly is driving the areas to explore on our site. She in her community actually did not find an area to explore, so she also wondered if not having one meant that they didn't have areas that they could focus on. And I would say that the data that we have, that there may not be an area to explore that pops up there, but it's really important for her community to, again, use the rankings as a starting point and then continue to look at what does the detailed data tell you. Can you start to break down the data within your community and understand if there are disparities in your community that may be worth focusing on? And so no matter where a community ranks, whether you're the healthiest community or healthiest county in your state or the least healthy county in your state, every community has an opportunity to improve health. And that area to explore feature on our site is, again, it's just a starting point for communities to start to think about where they might look. In terms of our methodology on the areas to explore, we look at the relative influence of each measure on health outcomes, and then we use a variety of techniques to help us identify health factor measures where a county might seem to have the greatest potential opportunity for improvement. So we identify measures where there are meaningful differences between your county's values and either your state average, the national benchmark, or those top performers, or the state average in the best state. So those are some things that we look at to help determine areas to explore. Great questions, Jill. We have a logistics question about whether this webinar will be archived, and it will be. We are recording today's webinar. You can also find slides from today's webinar available online. There are actually more detailed slides than what we showed you here, so you can start to see some of the areas that Jan went to on her tour, which wouldn't be part of those slides. We do have some screenshots in there, so you can kind of get a sense of that.
We have a question about whether there are examples of communities that have used the Action Center as a guide, and are those available on the site. Again, in our webinars section, our Take Action webinars have examples of communities that are working on each of the steps. So we've tried to highlight what sort of best practices are, or some great practices or promising practices, for example, on assessing needs and resources. And those webinars are archived on our site, and we have multiple examples of those. So we feature actual communities using that, and using not only the guidance but also the tools and how they use them.
We have a question about it, and it's something that we'd like to point out for folks. If you are using Internet Explorer, sometimes downloading the resources, the tools on our site can be a little tricky. So if you have access to Google Chrome or Mozilla Firefox, that can be an easier browser to download files from our site using. So that's a helpful tip. If you have the ability to use a different browser, Internet Explorer can be a little tricky for downloading our resources. So if you're running into that,
So we're coming to the end of our webinar, and we want to encourage you, if you have more questions, to go onto our site and hit that help button there, and you can email us, and feel free to contact us that way, or just pick up the phone and give us a call. We're here to help, and we look forward to talking with you about any of your questions. We mentioned the webinars in the Q&A. Our next webinar is going to be on Tuesday, June 24th, and it's going to focus on using health impact assessments to shape transit policy. PedNet Coalition in Boone County, Missouri is going to share how they use 2 HIAs, or health impact assessments, to help shape their efforts to improve public transportation options. To learn more about us, you can stay in touch with us through social media. Follow us on @CHRankings, and you can like our Facebook page, and you can sign up for our newsletter and learn more about our upcoming webinars and other offerings that are coming up through the program. The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including those listed here, and we want to thank all of them, and thank you for joining us on this webinar. We hope you feel inspired to reach out to others and take your next step wherever you are in your journey to building a culture of health in your community. Thank you, and goodbye.